Respected audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 35th lecture on pathology. Today's topic is Neoplasm, that is Neoplasia. Now come to day 1 of Neoplasm. Dear audience, before going to discuss about neoplasm, we have to know about tumor. What do we mean about tumor? Any abnormal swelling is known as tumor. Any abnormal swelling So any abnormal swelling is known as tumor. And this abnormal swelling may be due to neoplasm or may be due to non-neoplastic lesion. So tumor may be neoplastic tumor, that is abnormal swelling in neoplasm. Another is non-neoplastic tumor, that is abnormal swelling in non-neoplastic conditions. Now come to example of tumor in non-neoplastic conditions. Example: swelling, that is tumor in acute inflammation. Dear audience, you know reaction of vascularized living tissue to local injurious agent, provided the injurious agent does not destroy the tissue. It is called inflammation. And in acute inflammation, there are cardinal signs. You know, rubor means redness, calor means hot or heat, dolor means pain, tumor means swelling, and functionalism. So, in acute inflammation, one of the cardinal signs is tumor, and this tumor at the site of acute inflammation is nothing but swelling, and this swelling is due to exudate. So, the swelling or tumor in acute inflammation is an example of non-neoplastic tumor. Now come to neoplasm. Dear audience, in neoplasm there is neo and plasm. Neo means new. New means new. What is the definition of neoplasm? Definition given by Sir Rupert Willis. He is British oncologist. He has given a definition of neoplasm. Suppose this is dermis, and this is the epidermis, and it is composed of epidermal cells like this. Dear audience, you know epidermal cells are labile cell. What it means? The labile cells undergo multiplication at an regular interval, and there is shedding of cell from the epidermis. Suppose in this part of epidermis there is a stimulation. There is a stimulation. And due to stimulation in this part, the cells undergo rapid proliferation. So following stimulation, there is rapid proliferation. Rapid proliferation of the epidermal cells in this part. Due to rapid proliferation of cells in this epidermis, or in this part of this epidermis, there will be formation of an abnormal mass. Again, if this part of epidermis is stimulated by a stimulus, due to stimulation, there will be rapid proliferation of the cells in this part. And due to rapid proliferation of the cells in this part, there will be formation of an abnormal mass. So there is formation of abnormal mass. If now we remove the stimulus, after removal of the stimulus, if this abnormal mass continue to grow, then that abnormal mass is known as neoplasm. So after removal of stimulus, if the abnormal mass continues to grow, then this abnormal mass is known as neoplasm, called neoplasm. Again, in this part of epidermis, if it is stimulated by a stimulus, following stimulation, if there is rapid proliferation of the epidermal cells, due to rapid proliferation of the epidermal cells, there is formation of an abnormal mass. And after removal of this stimulus, if this abnormal mass continues to grow, then it is called neoplasm. Now come to definition given by Sir Rupert Willis. Abnormal mass of tissue, growth of which abnormal mass of tissue, growth of which exceeds and is uncoordinated abnormal mass of tissue, growth of which exceeds and is uncoordinated with that abnormal tissue So abnormal mass of tissue, this is abnormal mass of tissue, growth of which exceeds and uncoordinated with that of normal tissue. The growth of this abnormal tissue exceeds than the growth of the normal tissue and persists in the same excessive manner after the cessation of stimulus that evoked the change. is called neoplasm. Again, abnormal mass of tissue, growth of which exceeds and uncoordinated with that of normal tissue. Growth of which exceeds than the growth of this normal tissue and persist in the same excessive manner after the cessation of stimulus that evoke the change, and the growth persists like the previous manner after the removal of the stimulus is known as neoplasm. So this abnormal mass is known as neoplasm. Dear audience, now come to suffix used in neoplasm. Dear audience, you know, in inflammation, suffix is itis. The last part of word is itis in case of inflammation, like appendicitis, conjunctivitis, cholecystitis. In neoplasm, suffix is oma. Oma is the suffix. Oma is the suffix used in neoplasm. Example: lipoma, neoplasm of adipose tissue, there is oma. Fibroma, there is oma, neoplasm of fibroblast. Osteoma, neoplasm of bone. So suffix used in neoplasm is oma. Now come to hyperplasia. You know, in hyperplasia there is increased number of cells, and all cells are new cells. So what is the difference between hyperplasia and neoplasia? Now come to differences between hyperplasia and neoplasia. You know, in neoplasia there is abnormal mass of tissue and there is new cell is formed. What is hyperplasia? Increased number of cell resulting increased size of an organ is called hyperplasia. So what are the differences between hyperplasia and neoplasia? Hyperplasia is not autonomous. It is not autonomous, but it is autonomous. What it means? In hyperplasia, it needs stimulus, and for neoplasm, it needs stimulus. So, suppose this is hyperplasia. And this is neoplasia. In both cases, needs stimulation. It also requires stimulation. As for example, hyperplasia occurs in the uterine muscle during pregnancy, and the stimulation is estrogenic stimulation. If we consider the uterus after delivery of the baby, the uterus becomes normal in size. Hyperplasia not autonomous, but neoplasia is autonomous. What it means? In hyperplasia, it needs stimulation. After removal of stimulation, hyperplasia stops. Example, during pregnancy, there is hyperplasia of uterine muscle, the hyperplasia of the cells of the mammary glands in the breast, and after pregnancy, there is no estrogenic stimulation and hyperplasia is stopped. But in case of neoplasm, if we withdraw the stimulus, the growth of the mass is not stopped, rather it continues to grow. So after removal of stimulus, hyperplasia stops, but neoplasia does not stop, but it continues. So it is autonomous. Hyperplasia stops on removal of stimulus, but neoplasia continues to grow after the removal of stimulus. So it is autonomous. Why it is autonomous? Why hyperplasia is not autonomous? Although in both cases there is new cell is formed. Neoplasia is autonomous because the stimulus causes genetic mutation. So neoplasm continues. Dear audience, the basis of tumorigenesis, the basis of carcinogenesis is the genetic mutation. As in neoplasia there is genetic mutation, so after removal of the stimulus it continues, so it is autonomous. Another difference, hyperplasia is purposeful. It is purposeful, neoplasia is purposeless. What it means? Hyperplasia is purposeful. You know, during pregnancy there is hyperplasia of uterine muscle. If there is no hyperplasia in the uterine muscle during pregnancy, conception will not be possible. So hyperplasia in uterine muscle during pregnancy is desired and it is purposeful. But neoplasia or neoplasm is purposeless. Cancer is definitely purposeless growth. So these are the differences between neoplasia and hyperplasia. Dear audience, now come to component part of neoplasm. We know neoplasm is an abnormal mass of tissue. What are the component parts of neoplasm? The component parts, one is parenchyma. This is the neoplastic part. Parenchyma is composed of neoplastic cell. Parenchyma is composed of neoplastic cell. And supporting tissue is the stromal part. Stromal part. Now come to a term, desmoplasia. Desmoplasia. Dear audience, if any tumor contains maximum stromal part than the parenchymal part, this is known as desmoplasia. And the tumor where there is maximum stromal part than the parenchymal part, that tumor is called desmoplastic tumor. So, if stromal component is more than parenchymal part of a tumor, then it is called desmoplasia. And the tumor where there is maximum stromal part than the parenchymal part, the tumor is called desmoplastic tumor. And the tumor is called desmoplastic tumor. So in desmoplastic tumor, the stromal part or stromal component is maximum than the parenchymal part or parenchymal component. Now come to what is the importance of desmoplasia. Now come the importance of desmoplasia. Dear audience, you know, in chronic inflammation there is fibrosis. Tissue where there is chronic inflammation due to fibrosis, the site of chronic inflammatory lesion become hard due to fibrosis. And as there is stromal component is maximum in desmoplastic tumor, so desmoplastic tumor will be hard. So this hard tumor due to desmoplasia may be misinterpreted as chronic inflammatory lesion. Again, the chronic inflammatory lesion is hard due to fibrosis, and desmoplastic tumor due to maximum amount of stromal tissue is hard. So a tumor, that one is desmoplastic tumor, may be misinterpreted as chronic inflammatory lesion due to the hardness. Desmoplastic tumor is hard due to stromal component maximum. Chronic inflammatory lesion is also hard due to fibrosis. So, the desmoplastic tumor may be misinterpreted as chronic inflammatory lesion. So, desmoplastic tumor may be misinterpreted as chronic inflammatory lesion. Now come to example. Chronic mastitis. Dear audience, chronic inflammation of breast is called chronic mastitis. You know, in chronic mastitis there is fibrosis, and the lesion in the chronic mastitis become hard one. And if any mother suffers from desmoplastic tumor in the breast, it is also hard one. So, desmoplastic tumor in breast is hard, and chronic mastitis is also hard. So, desmoplastic tumor in breast may be misinterpreted as chronic mastitis because of hardness. desmoplastic tumor in breast may be misinterpreted as chronic mastitis due to hardness. So this is an example of desmoplastic tumor that may be misinterpreted as chronic inflammatory lesion. Dear audience, today I have told you about tumor, definition of neoplasm given by Sir Rupert Willis, abnormal mass of tissue, growth of which exceeds and is uncoordinated with that of normal tissue and persists in the same excessive manner after the sedation stimulus that evoke the change, and it is purposeless and autonomous. I have told you any abnormal swelling is called tumor, and tumor may be due to neoplasm, may be due to non-neoplasm. Example, tumor or swelling in acute inflammation. I have told you difference between hyperplasia and neoplasia. Neoplasia is purposeless, hyperplasia is purposeful. Neoplasia is autonomous, but hyperplasia is not autonomous. After removal of the stimulus, neoplasm continues to grow due to genetic mutation, but hyperplasia stops its growth. I have told you suffix used in neoplasm is oma. I have told you component part of neoplasm is stroma and parenchyma. I have told you about the desmoplasia and desmoplastic tumor and what is the importance of desmoplasia. Today up to this, thanks all.